International students. I'm from Ege University Medical Faculty. I'm associated professor in Turkey, and I'm specialized in cardiac rehabilitation. And the subject of this lecture is update version of cardiac rehabilitation. And the parts of my speech are as follows. The point of cardiovascular disease in the world, the point of cardiovascular disease in Turkey, fundamental parts of cardiac rehabilitation, cardiovascular team in the world in Uzbekistan and Turkey, cardiovascular cost in the world in Turkey and Uzbekistan, the cardiovascular program also in the world and Uzbekistan, and new technologies in terms of cardiac rehabilitation, minor diseases for which cardiac rehabilitation is applied. I want to give you information about the status of cardiovascular disease in Turkey and the world. In order to realize the status of cardiovascular disease in Turkey, I want to present you a study which has been started by Turkish Ministry of Health and Workforce Education in 2017 and will be completed in 2025. The common reason of global deaths in the world is non-communicable diseases, and the common reason of non-communicable disease is cardiovascular diseases. When we check the common reason of deaths in Turkey, we notice the same proportion. The common reason of deaths in Uzbekistan is also heart disease, as well as it is in Turkey. When we check the proportion of deaths in Uzbekistan, the most common reason is cardiovascular disease with respect to European figures. The proportion of deaths caused by ischemic heart disease in Turkey and Uzbekistan are very similar, as seen as 30% at the above chart. The most common reason of ischemic heart disease is physical inactivity in Uzbekistan, as well as it is in Turkey. In case of low proportion in physical activity, the proportion of risk factor is increasing. The proportion of low physical activity is around 30 or 40% both in Turkey and in Uzbekistan. In this part of our lecture, I will tell you about the fundamental parts of cardiac rehabilitation. The main components of cardiac rehabilitation are health behavior change and education, lifestyle risk factor management. These are physical activity and exercise training, healthy eating and body composition, tobacco cessation and relapse prevention, psychological treatment, medical risk management, long-term strategies, audit and evaluation. Cardiac rehabilitation should be performed by an experienced multidisciplinary team. The team should be managed by a high experienced medical director. The director will manage a team who has members as follows: dietitian, exercise specialist, nurse specialist, occupational therapist, pharmacist, physician with special interest in prevention and rehabilitation, physiotherapist, practitioner, psychologist. The cardiovascular prevention and rehabilitation team shall actively engage and collaborate with the patient's client's wider range team. These are general practitioners, practice nurses, cardiovascular disease specialist nurses, sports and leisure instructions, social workers, and educationalists to create a truly comprehensive approach to long-term management. A review made within coronary patients to attend in cardiac rehabilitation programs in 2018, and the results are found as follows. 50% of rehabilitation programs for coronary artery disease patients are for prevention. The ratio of attendance at least half of the sessions is about 80%. 70% of medical directors are cardiologists. 60% is general practitioner. According to another review made in 2018, the medical director of the team is physical rehabilitation medicine physician. The PMR physician having expertise in rehabilitation of cardiovascular conditions is to lead cardiac programs in multi-professional teams working in collaboration with other disciplines in a variety of settings to improve functioning of people with cardiovascular conditions. A review has made on the role of competence of the physical rehabilitation medicine specialist in 2016. According to this review, the key roles of physical medicine rehabilitation specialists are as follows: carrying out and coordination of diagnostic therapeutic cardiovascular events, design and assessment of included patients, monitoring patient progress and modifying the CR program, coordination of the safety parameters for CR programs and management of emergency and urgent conditions, communication with referring cardiologists and GPs, coordination and resolution of health insurance issues. When we look at the CR sentence in the Word and in the Turkey, when we check the models of cardiac rehabilitation in the Word, there are 111 centers in 203 countries in the world, so cardiovascular rehabilitation ratio in the world is about 50%. And in 85 countries, the CR centers are supervised. In about 51 countries, it has been developed alternative model CR, in which hybrid rehabilitation. These are home exercise, social and environmental groups under the supervision of physiotherapists. Although there was no significant difference in home and hospital exercise cost analysis, it was seen that cardiac rehabilitation made by phone or other communication tools brought more benefit. According to the world map, you can see the countries with black dot, in which there are no CR, even though the incidence of ischemic heart disease is high. Unfortunately, one of these countries is Uzbekistan. In this part, we will see the insurance coverage and reimbursement of CR programs for patients in the world. As you can see at the above review, there are 28 associations in the world. These associations advocate the increase of insurance coverage and reimbursement of CR programs for patients. Regardless of country and income status, CR cost is effective, especially in middle and low-income countries. The financial burden of avoidable complications will require more cost than CR. According to this review, there is no association in Turkey and in Uzbekistan to cover the cost of cardiac rehabilitation expenses. It seems high cost at the beginning of cardiac rehabilitation program. However, the cost of treatment is high at the heart disease occurred due to the lack of cardiac rehabilitation program. As you see at the first review, annual cost is between $2,000 to $28,000. Although the cost of hospital-based CR is high, it provides more benefit. Home cardiac rehabilitation saves about €1,000 compared to non-cardiac rehabilitation. According to cost of rehabilitation, cardiac rehabilitation is affordable. The lowest cost is the application of exercise therapy. And the second review shows us the delivery models in low-income countries. And the result is the financial resources must be considered for CR to be applicable in low-source environments. When we check the availability, use and barriers to cardiac rehabilitation in low and middle income countries, it shows the rate of attendance are low. Unfortunately, there are no data to review the status of Uzbekistan. The rate of cardiac rehabilitation in high-income countries is about 85%. It is 25% in the middle-income countries and 8% in the low-income countries. The reasons are lack of management, information, awareness of heart disease, family support, and negative opinions about health system, financial problems, and additional diseases. The most common reason for not participating in cardiac rehabilitation programs is not directed by the physicians. As a result, cardiac rehabilitation programs are not implemented as required in countries with low financial income. Participation in cardiac rehabilitation programs must be encouraged. We made a survey about cardiopulmonary rehabilitation information of the patients in Turkey. This cross-sectional study has been made on 690 patients with regard to cardiopulmonary rehabilitation awareness. About 30% of patients have been informed about cardiac rehabilitation by a medical team. 25% have been only directed by doctors. 50% of the patients are aware of making exercise due to heart disease. 30 to 20% of the patients are unconscious that rapid cardiopulmonary rehabilitation do not affect their health. 30% makes regular exercise. In case of cardiac rehabilitation team proposing exercise, about 60% of patients have accepted to participate in CR programs. As a result, the doctors should be in contact with cardiopulmonary rehabilitation team in order to increase the ratio of cardiopulmonary program attendance. With respect to the survey on the cardiopulmonary information of the doctors and nurses, we found the following issues. The distribution of total 727 team members in 12 centers are as follows: about around 60% doctors, 30% nurses, 6% physiotherapists, 3% other medical staff. Around 80% of medical staff attending to the inquiry have idea about cardiopulmonary rehabilitation, but do not have detailed information. It is considered that the doctors and other medical staff will be informed more, providing the number of cardiopulmonary rehabilitation centers are increasing. In this part, I will tell you about the application methods of cardiac rehabilitation programs according to the update guideline. The essential compound of cardiac rehabilitation program is aerobic exercise. According to the latest guideline, the aerobic exercise should be done 5 times in a week. Aerobic exercise are dynamic activities are made by large muscle groups. Stair climbing, walking, treadmill walking, cycling, swimming can be shown as examples. With respect to the individual capacity of the patient, the average duration of a session can be 30 minutes. The positive effect of aerobic exercise can be seen after 3 months. However, for obese patients, the effect will be seen after 6 months. The intensity of aerobic exercise can be measured with respect to the heart rate and the rate of perceived exertion. Rate of perceived exertion shows the feelings and response of the patient to aerobic exercise. Rate of perceived exertion is classified between 6 to 20 levels. The staff should ask the RPL level to the patients who have heart disease during the exercise. It must be within 13 to 15, somewhat hard. Another measure during exercise is heart rate. At this table, maximum heart rate, we can see the maximum heart rate, 50% and 75% of heart rate with respect to the ages. Therefore, the intensity of exercise for the patients who have heart disease should be between 50 to 75%. This table shows us high-intensity interval training for the patients who have heart disease. High-intensity interval training uses short bursts of intense exercise to achieve better fitness and athletic performance. High-intensity interval training workouts can be very effective for all age groups and ability levels. For beginners, the best starting point is to use less intense intervals. For example, 3 brief jogs can be mixed into a 20-minute brisk walk. This exercise is made 2 or 3 days in a week. The intensity of this exercise is done at 85% heart rate, as shown at about table. The duration of the session is 20 minutes, and the effect of it can be seen after 3 months. Some researchers found that this exercise method is more effective than the moderate method in terms of cardiac risk factors such as hypertension and diabetes and etc. At the first table, you can see light interval training. According to the table, the training should be given to the patients as 8 minutes warming, 1 minute running, 2 minutes walking for 20 minutes. Then the intensity of training can be increased with respect to the heart rate. As the second table, you can see the heart rate increase in degrees during the training program. One repetition maximum, 1 RM, is weightlifting, is the maximum amount of weight that a person can passively lift for 1 repetition. It may also be considered as maximum amount of force that can be generated in 1 maximal contraction. 1 repetition maximum can be used for determining an individual's maximum strength and is the method for determining the winner in the events such as powerlifting and weightlifting competitions. 1 repetition maximum can also be used as an upper limit in order to determine the desired load for an exercise as in a percentage of 1 RM. We can see the resistance workout muscles. There are major muscles here. 8 to 10 muscles should be selected from this table for the training activity. Activities for resistance exercises can be done with dumbbell, TheraBand, chest press, etc. in fitness. There are machines in fitness centers. Another activity is called circuit training. Circuit training is a form of body condition that involves endurance training, resistance training, high-intensity aerobics, and exercises performed in a circuit, similar to high-intensity interval training. It targets strength building and muscle endurance. An exercise circuit is one completion of all set exercise in the program. When one circuit is complete, one begins the first exercise again for the next circuit. Traditionally, the time between exercise in circuit training is short, often with rapid movement to the next exercise. You can find the part of the total body which you can apply for this type of training. For example, burpees, treadmills, squat thrusts, skipping, and jogging, and then you turn to the beginner. You turn to the top of you can begin to the burpees, treadmill, squat, skipping, and jogging again. Flexibility exercises. At the flexibility trainings, the stretching exercise should be done 2 or 3 days per week. The activity should be done on all major muscles in static method. The duration of stretching should be minimal 15 to 30 seconds for one type of muscle, and the number of stretching time should be 2 to 4. The positive effect of stretching exercises can be seen after 4 to 6 months. According to American Heart Association, American Association Cardiovascular and Pulmonary Rehabilitation, Canadian Association of Cardiac Rehabilitation, European Association of Cardiac Rehabilitation, Austrian Cardiac Health and Rehabilitation, and WHO made a guideline. ECG exercise test should be done before moderate intensity aerobic exercise, and the necessary resistance exercise should also be added to moderate intensity aerobic exercise. Before low-medium aerobic exercise, it is not necessary to do exercise test, and it is not needed to add resistance exercise after low-medium aerobic exercise. If the patient has multimetabolic or renal diseases and any sign and symptoms suggestive of cardiac disease, then it is recommended medical clearance of cardiologist. If the confirmation of cardiologist is given, the patient can start to low to moderate exercise, aerobic exercise. In this part, we will mention about new technologies for cardiac rehabilitation. The first one, the patient, the patients can download applications on their smartphones which can explain diet, exercise programs with respect to instructions of the physician. In the second picture, in case of pandemic conditions, the doctor can set virtual-based interviews to explain the exercise program for the patients attend to this session. In the third picture, the social robot based its behavior on 3 situations: motivation, warning, and emergency, which can be triggered depending on the time of the session and the data provided by the interface. Likewise, these behaviors can be developed aiming to provide similar assistance as health professionals do. Thank you for listening to me. I would be very grateful if you can email me back. I will give you my email, and then you can say comments to me. Thank you, international students. Bye.